All right. Welcome, everyone. Thanks for joining us today. First, we have Josh Jones. He is a student at Spalding University. He's working towards a doctoral degree in clinical psychology and is currently practicing under Dr. Brian Davis. He has a master's degree in both mental health counseling and liberal studies and philosophy. Previously, he taught philosophy classes at Indiana University Southeast and Ivy Tech Community College. Then we also have Micah Lewis, another clinical psychology student. Micah is a doctoral candidate in the clinical psychology PsyD program at Spalding University with a concentration in neuropsychology. Before joining the Norton Neuroscience Institute, Micah earned a bachelor's degree in cognitive science from Johns Hopkins University and a master's degree in clinical psychology from Spalding University. Micah's clinical interests include the assessment of patients with neurodegenerative diseases, especially for clarification of comorbid neurological and neuropsychiatric symptoms, as well as the treatment of complex medical conditions and functional neurological symptoms. And with that, I'm going to leave it to you guys and go ahead and get started.
All right, I will take us away. So excited to meet all of you and speak today. So today we're going to talk a bit about insomnia, about interventions and information. So during our presentation today, we're going to cover an overview about sleep, about what insomnia is, how we might want to think about it. We'll also talk about how insomnia and other sleep-wake disorders are diagnosed. We're going to speak a bit about the cognitive and physiological impacts that occur from experiencing insufficient sleep, and then also about various interventions for people that are living with insomnia, as well as the gold standard treatment, which is CBTI, or cognitive behavioral therapy for insomnia. So on this slide, we've written out a list of questions that can help you determine whether you are experiencing insufficient sleep or insomnia. And these are really important questions that you can ask yourself to help figure out if seeing a behavioral sleep specialist or a health psychologist could be right for you and your loved ones. So most importantly would be, when and how are you falling asleep? When are you waking up? Are you waking up at a consistent time or at a variable time? How often are you waking up during the night, during a typical night? Do you have any follow problems with falling asleep, with staying asleep? And what does your sleeping environment look like? Are you in a bed with someone else? Are you sleeping upright in a chair? And what do the 2 hours before your sleep look like? What is the pre-sleep environment doing for you? And how are you responding to the pressures of sleep and sleepiness? So we just talked about the problems that people could experience with falling or staying asleep. So now I'm going to walk you through kind of the science and the neurobiology that can underpin sleep, which all humans need. So we all sleep, right? It's a natural process of reduced responsiveness, and it's accompanied by a loss of consciousness. So we typically get in bed and we hope that our alarm clock doesn't go off in the morning, or at least that's what I do. You know, something that varies for all of us, regardless of if we sleep, is how much we're sleeping. And there's support from the Sleep Foundation and from the Center for Disease Control and Prevention on how much sleep that you should be aiming to get every day. So if you look at this chart, you can see that an infant should get somewhere between 12 to 15 hours of sleep per day. And this would include your nap time. But for an adult, the recommended amount of sleep that you should get is somewhere between 7 to 9 hours of sleep per day. So I want you to consider that there are various aspects of your sleep that contribute to your overall health and your well-being beyond just the physical amount of sleep that you're receiving. So you could have poor sleep quality that could result from those difficulties, like we talked about before, of falling asleep, staying asleep, or some symptoms of sleep disorders, like snoring or having difficulty with continuous breathing. And we're going to talk a bit more in depth about those sleep disorders. But I want you to consider that the sleep quality, as well as the sleep quantity that you're having, is extremely important because there are many chronic health conditions that are linked to declines in your overall sleep and your sleep quality. So these conditions could include diabetes, neurodegenerative conditions like Alzheimer's disease, chronic pain conditions, obstructive or central sleep apnea, and mood conditions like depression or anxiety. And not getting enough sleep is linked to the development of several chronic health issues. So this could be the development of cardiovascular concerns, metabolic changes, diabetes, depression, or post-traumatic stress and trauma. So you know now that not getting enough sleep or having insufficient sleep leads to a variety of health conditions and problems. And when people often present to us about problems related to the amount of sleep that they're receiving, its quality, or the timing around which they're sleeping, they might meet criteria for what we would call a sleep-wake disorder, where insomnia is the most common sleep-wake disorder. So specific issues that people might cite when they're having insufficient sleep are that they're experiencing increased amounts of stress, they're feeling maybe more irritable or more sad, they feel more fatigued or overly tired, or that they're having a lack of interest or motivation to do daily activities. There's research that shows that experiencing a high level of stress can stimulate cortisol production. Cortisol is a stress hormone that we all have and we all need for daily behaviors. And normally it helps people to wake up in the morning and to head to sleep at night at regular intervals. But when cortisol levels are elevated due to feeling overly stressed, it can lead to issues with chronic insomnia and difficulty falling asleep at the regular or at the right time. So if we understand insomnia as a larger societal issue, it's more common in women and in older adults, where older women are at the highest risk for developing insomnia. There was a literature review that was done by Patel and Steinberg in 2018, that found that older adults are at the highest risk for developing insomnia, chronic insomnia, or acute insomnia, due to the impact of medical conditions and polypharmacy, which is that there are multiple medications interacting that then affect your sleep. When we're diagnosing insomnia as well, we like to consider something between primary insomnia and secondary insomnia. So secondary insomnia would be where problems with your sleep are due to a medical condition or the polypharmacy of medications. And primary insomnia is that which cannot be attributable to medical, psychiatric, or environmental causes. If you think about insomnia as a whole, there's a whopping 22% of the whole world that experiences acute or chronic insomnia. And that makes this a really important area that treatment needs to be aimed towards. America, in particular, though, actually has a higher percentage of the population experiencing insomnia. So, approximately 30% of the American population has experienced short term or acute insomnia with sleep difficulties that are lasting up to 3 months. And then chronic insomnia occurs in about 10% of the American population. And that's when people are experiencing insomnia for longer than that 3 month period. So when we are diagnosing people with insomnia or another sleep-wake disorder condition, we want to understand both your sleep quality and how your sleep quantity are impacting your overall health. And this would include both your physical and your mental health and well-being. So when someone's having issues with their sleep quality, their sleep quantity, or the timing of their sleep cycles, they may meet criteria for an insomnia condition. And for the diagnosis of insomnia in particular, individuals must report issues that occur at least 3 nights a week and last for at least 3 months. In this way, we're specifically diagnosing when someone's experiencing chronic insomnia. But if you show up and are experiencing sleep issues that have only lasted 2 months, you can still receive treatment and benefit from treatment as much as someone who has chronic insomnia. People often report having issues with falling or staying asleep, waking up multiple times during the night, or being unable to fall back asleep during the middle of the night. And most people often say that they experience brain fog as a result of this. So, this is a phrase that covers a lot of different symptoms. So, this could include difficulty concentrating, problems with multitasking, switching tasks, planning or carrying out tasks, maybe also some difficulty with impulsivity, managing your emotional responses or your emotion regulation when you experience an outside stressful event. So, that sleep insufficiency, having insomnia, is really closely linked to cognitive functioning. So, those symptoms of inattentiveness, multitasking that I just described, but also your ability to get through the day as a whole. And this is based on issues that sleep insufficiency might cause in your memory and your learning abilities. So, having a good night of sleep can help you to strengthen potency of the memories that you've made throughout the day, as well as make connections to the earlier memories that you have. So, not having enough sleep can cause issues with memory consolidation and encoding of your memory and learning. And this means that it might be more difficult for you to remember, to retain new information that you learned that day, or to recall memories or information from the day or week or month prior, or people often report becoming more forgetful. You might also have more trouble with paying attention, staying concentrated, or moving quickly from one task to another. And this can make day to day activities a lot more difficult. And it's one of the reasons that insomnia has such far reaching effects. When someone comes in for an initial evaluation with a behavioral sleep specialist, we often consider whether there are other symptoms or conditions that might be contributing to or maintaining the sleep insufficiency that someone is reporting to us. And it's really important for you and anyone who receives these treatment services to consider that treatment of these conditions can in self improve the quality or quantity or the timing of sleep for many individuals. So, we want to ensure that any treatment that people receive can address all of the areas that could improve your sleep by itself. So, the first of these issues that could potentially impact your sleep would be substance use. So, both the effect of substance use as well as the withdrawal impact from various substances like alcohol or marijuana or other illicit drugs could cause sleep issues. Restless leg syndrome as well. So, the urge to move your leg could be worse in the evening for many people, and this could cause sleep problems. So, treating the symptoms of the restless leg syndrome could improve your ability to fall asleep or stay asleep. People that have experienced trauma and meet criteria for post traumatic stress disorder, PTSD, can also experience nightmares or sleep disturbances, and this can cause problems with your sleep. People often cite as well that they have comorbid depression or depressive symptoms. where insomnia or hypersomnia, so oversleeping, are classic hallmark symptoms of depression that can make depressive symptoms worse. People also could have anxiety, where they have problems with restlessness or staying asleep or even falling asleep because there's cognitions and thought processes that make it difficult to kind of shut your brain down and fall asleep. People could also have central or obstructive sleep apnea. So, central sleep apnea is a disorder where the brain doesn't send proper signals to the muscles that control breathing when a person is asleep. And this would cause someone to have trouble maintaining their continuous breathing. Obstructive breathing is slightly different in that there's a mechanical obstruction of your airway, and this prevents continuous breathing. So, the treatment of either of these with a CPAP machine or other medical interventions could allow someone to have a better night's sleep. And when we're considering whether you have sleep conditions, it's important to rule out whether any of these other symptoms and conditions could be impacting your sleep disorder. So, we've spent a lot of time now talking about what insomnia is and what leads to or helps maintain it. So, now it's time for us to discuss the interventions that could treat insomnia, which I assume is probably the reason that a lot of you joined today. So, this brief overview that I'm going to discuss here is something that Josh is going to go into a lot more detail with. But just to start us off, to treat insomnia, it's really helpful to become more aware of the unhelpful or the maladaptive thought processes that you're having around the concept of sleeping, going to sleep, or about being in your bed. We advise people that are suffering from or living with insomnia and sleep insufficiency to limit how much time they're spending in their bed or in their bedroom if that's possible. The best way to recalibrate your cortisol levels is to wake up at the same time every morning. So, cortisol levels typically peak about 30 to 45 minutes after you wake up, and engaging in healthy sleep and lifestyle habits can help your cortisol levels to remain stable and to lower your overall stress levels in order to have better overall sleep. And these overall sleep and lifestyle habits are incorporated into what we would call sleep hygiene. And this is a really important area of treatment for insomnia that anyone can incorporate into their daily life to improve their sleep behaviors.
Well, thank you so much, Micah. I want to say before we get started here, or before I get started, I should say, we do have the Q&A chat going. And so if there are questions that arise or things that you want to know a little bit more about, just click on that and throw them in there. We'll spend the last few minutes answering those particular questions. But I really just kind of want to give a more fine-grained view of each of those methods that Micah was talking about. And really, from a psychological standpoint, what we do to kind of conceptualize insomnia is kind of a three-tier process of looking at how our thoughts influence our behaviors and how those behaviors ultimately lead to insomnia. And so, a common issue that we see in the clinic happens to deal a lot with how people really approach sleep and what thoughts they bring with them to sleep. And so there's a number of different versions of the thoughts that I've got listed here. I try to give kind of two very different versions of maladaptive thoughts. It's not always helpful to think of them as maladaptive thoughts, but sometimes that's how we conceptualize them. And I'll talk a little bit more about that on the next slide. But the main idea behind this is that there are certain thoughts that we have, and that those thoughts lead to particular behaviors that are problematic for us. So one of the thoughts I have listed here is that I need a television on to help my mind calm down. And that's a common kind of thought process that people have. There's other things we could substitute for that, like I need a drink of Coke, I need a cup of coffee, like various things that we think of that are really triggers to help us feel like we're relaxed and calmed down, when in fact they create the behavior that keeps us up at night. So in the instance of using the television to help your mind calm down, it actually exposes you to blue light. And blue light exposure is what's considered a melatonin blocker. And so ultimately, just like when you're maybe getting on the airplane and take some melatonin, right, to fall asleep, um, blocking melatonin it creates a problem for you to be able to actually fall asleep. And one of the things, just like caffeine kind of works, as you are exposed to blue light, you want more blue lights. And so watching, 15 minutes of television to fall asleep quickly turns into watching 20 minutes and then 30 minutes. And then you're up all night watching TV and you don't know really, where it began. Um, Another version of this, though, is also punishing thought that we sometimes think of when we're trying to fall asleep and feel that we're not getting enough sleep. So another thought that I have listed here is if I do not fall asleep by 11 p.m., I will not get the right amount of sleep, and I only have 5 minutes left before it's 11 p.m. So sometimes we do this counting sheep kind of method, but instead of doing that, we count minutes, right? And we think, oh no, I haven't fallen asleep, and now I've only got 5 minutes. Now I've only got four. Now I've only got three, and it just keeps going. And so what ends up happening is that you keep yourself up, worried all night. Maybe you give yourself a new deadline of a new hour, and you count every minute, right, while that goes by. And ultimately, what we see is that insomnia is really this maintenance of these problematic behaviors. And so, what we like to really do to solve that problem is to look at the thoughts themselves and use a couple of different techniques to interrupt that thought cycle. So three of the ways in which we interrupt those maladaptive thoughts is, so first of all, just look at exceptions to those thoughts. So if you're sitting down and thinking to yourself that you need to listen to the TV or watch TV in order to be able to fall asleep, we start off by just thinking of, well, are there times when you didn't need the television to fall asleep? Has every day of your life always had a television right by it, or were there times when you were able to fall asleep without looking at the television? And again, if we substitute in any of the other things that we might think of for that, again, a cup of coffee, I know sounds very counterintuitive already, but there's a lot of people who think that if I have a drink of coffee, that will really calm me down, or if I have this glass of wine, right, that will really kind of take the edge off. And what we end up finding is that thought, again, leads to those behaviors. So if we interrupt it at the beginning and say, well, was there ever a time when you didn't have a glass of wine and you still fell asleep? Or was there ever a time when you didn't have the TV on, like I said, and still fell asleep? We can start to build off of that, and really, in some ways, challenge the thoughts that you have to have it in order to be able to fall asleep. A second technique that I think is really useful and helpful is what's called thought diffusion. And this is just the acknowledgement that what you're thinking at that moment is just a thought like all the other thoughts that you have. One of the main things that we look at when we start talking to people about insomnia is how helpful the thoughts that we have are and how much attention we give the thoughts that we have. And a lot of times, when people have insomnia, they give the thoughts that keep them up a lot more attention than they do some of the other thoughts. The original idea behind counting sheep is really to give attention to other thought. Is looking at just like a flashlight uses light and points it in one particular direction. Our attention focuses on particular thought, and we can really choose to what degree we want to have those thoughts. So when we think of things like I'm not getting enough sleep right now, or I'm going to be really terrible tomorrow because I haven't had the right night's sleep for the last 4 nights. Acknowledging that that's just a thought. It's not reality. It's not necessarily how things are going to pan out. It's just a thought we're experiencing in the moment, and allowing ourselves to think about other thoughts as well. replaying the day and thinking about things that we really enjoyed, moments that we despite maybe not having enough sleep that day, right? We still had fun doing. And again, just looking at those thoughts and recognizing that in the totality of all the thoughts that we have, the thoughts that tell us we need more sleep or that we're not doing enough, they're just thoughts. And we can give them as much attention as we want to, or we can pull our attention away towards other thoughts as well. And then the last thing here is really, out of all the things I could mention, my favorite thing to talk about, and that's self-compassion, and that's the idea of in the particular moment where you're experiencing a thought that isn't helpful for you, what is something that you can do to show kindness towards yourself? So a lot of times when we look at what we would call a maladaptive thought, there's usually something else behind that. Again, to go to my example of watching television and feeling the need to do that in order to be able to fall asleep, we usually make that association because we're wanting something. We need something deeper behind it. And the practice of self-compassion is really allowing ourselves to have the thing that we need, again, to show kindness towards ourselves and to allow us to think about other things, to allow us to have what we might think of as authentic thought in that moment. And there's a whole host of things that I would suggest towards self-compassion. We don't have enough time to kind of dig down like through all of them. But one of the most important things in terms of sleep is giving yourself enough comfort to fall asleep. So if you find that you're in a situation where you're on a mattress and you're like, I don't like the way I sit on this mattress, right? Or I don't like the way that this blanket feels, right? Or any of the other things in your room that you just kind of notice, it's like that really stands out to me. Right? Allow yourself to make the changes that again show yourself kindness, and ultimately help you fall asleep. Along those same lines, we talk about this idea of stimulus control. And really, what this happens to deal with is the associations that our brain makes with our environment. We do this all the time in every environment that we're in. But when we look at insomnia, what's really important is the connection that our brain is making to our bed. And as we start to engage in lots of other activities, our brain starts to associate those activities with what we're doing inside the bed. So if you look at the cartoon here, right, where it's hitting the ball back and forth, if we start to do other things other than sleep inside our bed, then our brain will start making the association that we want to do that. A lot of people like to eat inside their bed. And they when they go to their bed and they start to feel hungry, they wonder why they're feeling hungry at that moment. And it really happens to be because their brain starts to make that association, right? If I'm eating Cheetos right inside my bed, then ultimately I'm going to start to want Cheetos right when I go to my bed. And by the same token, if we recognize the fact that our bed is really for sleeping, and that's the main purpose behind it, we can start to look at our environment and recognize that there are maybe things that we need to clear out from our environment that distract us from finding that sleep that's really important. And so, the three things that I have limited, or the three things I have listed here, are really important in making sure that your brain makes that connection with the bed. So again, limiting it to just sleep and intimacy is an important part of helping your brain get that hard reset, and again, making the right kind of association. Clearing a designated time for when you're going to actually fall asleep, and a designated time when you're going to stop using the bed. So again, if you say, I'm going to for sure wake up at 6:45, making that a hard commitment in your life, and deciding at 6:45 I'm out, that's my wake up time. Your brain will start again making that association. And then, as I mentioned, just eliminating activities that surround the bed. So making sure that what you do inside the bed is only sleeping and nothing else. And ultimately, what that ends up doing is that it makes that connection between your environment and your brain that you're wanting in order to get the night sleep that you need. Um, the science behind this is kind of really straightforward. There's what we call the two-process model or the dual process model of sleep. And basically what it kind of postulates is that there's kind of two different components to our body that are really important. One of them is the natural cycle that our body falls into when it's trying to get sleep, what's called our circadian rhythm. And so what this really is kind of a power up and power down moment throughout our day. When we wake up, our body feels really well rested, and we're increasing our energy up through about half of the day, right? So we might get in a regular rhythm of doing things like taking a shower, eating breakfast, right? Going through our morning commutes, things like that. And our body starts to level off in the midday in terms of energy. And many of you probably have this sensation or feeling where, a little bit after lunch, your energy starts to wane down. Combined with that was kind of what Micah was talking about with our cortisol levels. Our cortisol levels actually hit the lowest points around midnight and the highest points when we wake up. It just kind of rises up. And that is in combination with what we call our sleep pressure. So that when we wake up, our sleep pressure is at its lowest point. And as we go throughout the day, our sleep pressure is building over time until we get to the point where we feel extremely tired. And what we really want to do is kind of combine these two areas together. We want our sleep pressure to match up with where our body is powering down. So that when we get to the very end of the night or the very end of the day, our body that feels really tired matches our sleep pressure, which is at its highest level. And problem that we have is that if we interrupt that sleep pressure and reset it in the middle of the day by taking a nap, then it starts to reset the pressure and the synchronization of our circadian rhythm. A lot of times you'll notice that people feel different on a Monday than they do on a Wednesday or a Thursday. And part of that is because they change the time that they wake up on Saturday and Sunday. When it's the weekend, they're like, hey, I don't have to be at work. I'm going to sleep in a little bit. And so that moves their wake up time a little bit further down. And so one thing that we really focus on in working with clients is really trying to sync up, right, that sleep pressure time with their circadian rhythm so that you get the maximum amount of sleep pressure for when your body powers down. And as you can see from this graph, when you don't do that, when you take the nap, there is a very clear difference that exists between those two. Again, when we look at this, it's not a problem if you are taking naps and you're like, uh-oh, all right, what do I do about that? Because if you think about that difference between Monday and Wednesday, right, it doesn't take very long for your body to reset its circadian cycle. And so ultimately, we can end up in a really good situation if we're just waking up at the same time every single day. And that's really probably of all of the techniques that we talk about, the one that's the most important. If you find yourself falling asleep at different times of the night, that's okay. Everyone does that throughout their life. We meet different demands, but if we set a consistent wake up time, our circadian rhythm will ultimately reset itself to a point where it matches our sleep pressure, and we're able to sleep on the cycle that we want to. Micah is going to finish us out here with our techniques, and then we will answer the questions I see are populating right now.
Great. So thank you, Josh. You did a great job kind of talking through that sleep model of the circadian rhythm. So Like both Josh and I talked about, how we encourage people to limit how much time they're sleeping in bed, this is the best technique that people can do in order to adjust how their sleeping quality and quantity is. And we would call this engaging in a sleep restriction. So if someone reports that they go to bed at 9 p.m. at night and that they wake up every morning at 6 a.m., so they're in bed for 9 hours, they're actually only sleeping for 6 of those hours because they wake up multiple times or they find it difficult to fall asleep. We would ask them for sleep restriction goals to only be in their bed for those 6 hours. This would mean that they then are moving their bedtime slightly later to about midnight so that they're then having only time in the bed that they are sleeping in. So this looks like adjusting when you go to sleep so that you're only engaging in sleep behaviors in your bed. So there's less time that you're spending in the bed thinking about sleep. There's less time that you have in the bed worrying about or having those maladaptive thought patterns like Josh talked about. You're only doing sleep behaviors. I also want to reiterate, following Josh's comments, that this means moving the non-sleeping activities away from your bed. So if you like watching TV in bed, because a lot of us do, it's really comfy, we would encourage you to only watch TV on the couch, to not eat in your bed, or to avoid lounging in your bed if you're not actively trying to go to sleep. And this is really important because it means that you're adjusting the associations that you have with your bed and maybe reducing the negative ones that you have around sleep. There's also a lot of high quality evidence coming from the APA and multiple medical associations that CBTI, or a lot of these techniques and models that we've talked about, is the best frontline treatment for individuals that are living with insomnia or experiencing sleep insufficiency. It's the best treatment pharmacologically or non-pharmacologically, meaning that the CBTI is better than medications for treating people who are experiencing insomnia. Treatment with CBTI has been found to have a really large impact on the distress that people are experiencing related to their insomnia. So people who follow treatment with CBTI report that they have much improved sleep quality and sleep quantity, and the effects of CBTI are really long lasting. They can have large improvements on someone's life, and people often report having improved sleep for at least a year following their treatment with CBTI. And there are several areas beyond just sleep where CBTI have improvements. So people's quality of life often improves. So this is their subjective enjoyment or the well-being of the person. They might also have better mood symptoms or psychiatric symptoms. And people also report that sometimes their physiological symptoms of inflammation can improve too. And all of these benefits can be found through participation in and treatment with CBTI, though engaging in several or any of the sleep hygiene practices that Josh and I have discussed throughout this presentation, or in working with a behavioral sleep specialist, can improve you. So if you think that yourself or a family member or someone that you know who's experiencing insomnia or could benefit from treatment work with a behavioral sleep specialist, we have several clinicians that are here at the Norton Neuroscience Institute that are trained to work with you in this area, who have received training in CBTI or in treating insomnia. So I'm going to have Josh slide over to the next one. And I want to open up our presentation now to any questions that you as the audience might have. And I just want to thank Megan in advance for moderating the questions in our chat box.
Sure. Yeah,
And we're really excited to answer you all.
We have several that are already in here, so I'm just going to kind of go down the list from the beginning. The first one is from
All right.
Lisa. It says, "Where can I see a sleep specialist?"
Yeah, so you can see a sleep specialist here at Norton's. Dr. Brian Davis, who supervises both Josh and I, is a trained CBTI clinician, and there are multiple other clinicians through behavioral health that you can see here.
Great. The next one is from Kelly. Does having a sleep monitoring device, such as a Fitbit or Apple Watch, help or hurt our sleep patterns? In other words, are those devices reliable for monitoring our sleep?
Yeah, I'll let you talk here too, Micah. But I actually think that there's some conclusive evidence about the benefit that you get from it. But it really depends a lot on how you use it. The way that most monitoring devices work is by putting green or blue light through your veins and measuring the degree to which your blood is moving through your veins. It's been shown that on persons of color, that the accuracy rates is not as good. And in particular, Apple's Watch seems to to be a little bit more problematic. There are a lot of devices that are close to the Holter monitors that we might use to be able to kind of measure the accuracy rate a little bit better. And for those, they use a slightly different method, which is counting your pulse rates based off of the pressure of your blood as it moves through your veins by looking at the actual movement that happens. Depending on which method you use, the accuracy changes a whole lot. But overall, I think that getting some data, even if it's inaccurate a little bit, still gives you an idea of the degree to which there are fluctuations or changes in your sleeping pattern. And I think looking at it in the long view instead of the short view, so not night to night, what does it look like, but over a week, right? Is there a change over a month? Do you notice that Mondays are worse overall than like rest of the week? And getting that kind of data is always beneficial. There isn't any evidence to suggest that wearing a device while you're sleeping is harmful towards you. However, you do want to make sure that going with the blue light exposure, that you're not having any of your monitors or any of your watches or anything like that face you while you're sleeping. So facing it out, usually wearing it on your wrist, is important in the other direction. And again, making sure that you don't have your phone next to you while that's going on, because again of the blue light that causes the melatonin blocking. But aside from that, I am very pro device use because of the data that you can get out of it. Micah, if there's anything you want to add there, go ahead.
I think you did an excellent job discussing that. I don't know that I have anything to add there, except that yes, devices can be super helpful, especially when you're seeing someone for sleep improvement, and data is a good thing.
Okay. Our next question. My husband says that we wouldn't sleep unless we need it. Is that true?
Well, evolutionarily, we do all need sleep. So I would agree that it's true that we do need sleep, but that there's a certain quality and quantity of sleep that's really helpful for us to get. So if someone is reporting that they feel refreshed and that they feel okay after receiving only 5 hours of sleep, that could be okay depending on the individual circumstances. But if someone is getting 9 or 10 or 12 hours and still feeling very sluggish, or that they are waking up and not fully awake or functional, then they may need some differences in how they're engaging in sleep.
Sure. Makes sense. last question we have, unless we have any more, please go ahead and put those in the chat box. Should you nap in bed or on the sofa?
Um, so I would make a big suggestion here to cut naps out in general. And it's really in a lot of ways disruptive. Again, going back to the graphs that I was showing of the overall sleep pressure that you gain throughout the day. If you are going to fall asleep, no matter what, again, making the association with sleep and your bed is really important. But one other aspect of nap being disruptive, aside from the fact that it disrupts your sleep pressure, is that it often changes how you feel for the time afterwards as well. One of the other associations that your brain makes is when you wake up, what your immediate surrounding looks like. There's this really interesting experiment that they did a few years ago with the astronauts in space on the International Space Station, where they exposed them to different colors of light. They found that a nice little rosy red-orange kind of tint 2 hours before you fall asleep really, for some reason, helped increase the amount of sleep that you got overall. Because it kind of mimics the sunset going down. And one of the problems with having a nap at any time in the day is that the associations that you're making throughout the day with what sleep looks like starts to change the more naps that you throw in there. So I would say if you're feeling tired throughout the day to the point where you want to take a nap, I would suggest waking up at a later time so that you're getting the extra sleep that your body needs, and really trying to cut out naps to the best degree that you can.
Between napping on the couch and watching TV in bed, you guys have ruined my day. My favorite activities. All right. I don't know if we have any more. We have one more question. Can you provide some information about REM sleep disorder? Are there any best practices surrounding sleep when experiencing REM episodes?
Um, so I don't know a lot about REM sleep disorder, but to the best of my knowledge, it's when someone's experiencing a lot less REM stage sleep. So in that situation, I would encourage people to place themselves in the safest location when they're sleeping so that they feel comfortable and they're able to, feel safe when they're both falling asleep and waking, so that if they wake up and feel maybe a sense of confusion or difficulty with kind of the proprioception of placing themselves, that they are able to feel safer when they're coming out of sleep. Again, engaging in all of those different techniques that we talked about of waking up at the same time in the same place will also be helpful.
All right. I don't think we have any questions. Somebody asked if this would be recorded. Yes, it's being recorded. It will be available on YouTube in a couple of weeks. Also, if you guys want to join us again on July 3rd, Josh will be back for a stress management workshop. Let's see, we do have one more question and then we will wrap it up. How does a brain injury affect sleep?
So I think me and Michael will probably both give an answer to this question. The answer that I would give is that it's different for every person. So there's not one a formula for how a brain injury can affect sleep, there's major differences based off of what areas of the brain are most affected. So in a lot of cases where we look at something like a TBI, a traumatic brain injury, usually what's happening is that your brain rests on your skull and it's slid slightly out of place. And so a lot of the adjustment that happens is as your brain is kind of sliding back, and I'm using my knuckles very loosely here, right? But as your brain is sliding back to rest on your skull, there's all kinds of different adjustments that your body feels. One of the most common is nausea. And just a feeling of discomfort in general. And that obviously can have major effects on how you feel when you're falling asleep. But every person's brain injury journey is different, and no two are exactly alike. I think for myself, going back to what I was saying about self-compassion, is giving yourself the grace to recognize that you're in a situation that's a little bit different than what you were beforehand, and that it may take you longer to engage in certain activities or to even be able to process what is happening. I think is really the most helpful thing for approaching a night's sleep, and recognizing that for a while you might need to change your routine. You might need to give yourself some more sleep, maybe waking up at a later time, and by the same token, maybe changing some of those environmental cues, right, to again make sleep more enjoyable, more approachable. I think all those things are very important. But Micah is kind of an expert in some of these areas, so I'm going to defer to Micah here.
Right? That expert phrase is a little scary, but there's a lot of research that shows that when someone experiences a traumatic brain injury or an acquired brain injury that's non-traumatic as well, there's like a 30 to 50% increase in your likelihood of experiencing sleep insufficiency or poor quality sleep, which is one of the reasons that people who've experienced a brain injury often report having a lot more sleepiness. And then this can have impacts kind of downwind on your overall cognition. So, like I said during the presentation, that having poor sleep can result in executive functioning and cognitive issues. People who experience brain injuries often themselves are experiencing poor cognitive performance and problems with sleep that occur as well in addition to their brain injury can make this cognitive performance worse. So for someone that has experienced a brain injury, whether it's acute, so something that's happened within the past month in which they're kind of actively rehabilitating, or in the situation where they've experienced chronic brain injuries or a brain injury that happened a while ago, it can still be helpful to engage in healthy sleep hygiene habits and behaviors in order to improve their sleep habits. Because cognition and improvement in cognition subjectively, so your perception of how your cognition and your mind is able to engage in things, is improved when you have better sleep. So even if you've had a brain injury 5 years ago, but you're sleeping a lot better now, people will often report personal perceptions that they're doing a lot better. So for anyone that's experienced a brain injury, they will still benefit from increased sleep behaviors and habits.
Okay, I think that is it as far as the questions go. Again, thank you so much, Josh and Micah. It was all very informative, and I hope everyone has a great day.